So good morning, everybody, and thank you for joining us on this multi-regional launch of our new tools for the control of Taenia solium. Thanks a lot for being so numerous on this call. I'm Bernadetta Bellarida. I lead the work on Taenia solium, but also I lead the work on the management of zoonotic diseases in the Neglected Tropical Diseases Department at the World Health Organization. And I'm happy to be able to host you today. I would like to share the regrets of the director of the Neglected Tropical Diseases Department, who will not be able to join us on this session, but she does send us all her best regards. And just to kick off, I will start with a few housekeeping rules. We have a chat facility for you should you want to pose any questions. We will try to respond to most of your questions either through the chat or at the end when we have a discussion time. Next slide. We also have interpretation for you. We have English, French, and Portuguese. You can select these by going to the tabs on the bottom. The right-hand tab says interpretation. If you click on that, you can select your language. Next slide. We have muted participants so that we do not have any disturbances, but you can communicate with us through the chat, and thank you for your understanding. Next. Should you be on social media, we would appreciate you also tweeting quotes or photos or anything relevant that you listen to during this presentation. Here are the hashtags that we're using. And I would like to thank all the countries, all our NTD partners from both the private and public sectors that have really contributed to making this webinar today come to fruition. So with that, I would like to just start with just putting forward the importance of Taenia cysticercosis. It has been part of the WHO NTD list since the inception of the program. And we know that neurocysticercosis is the most frequent preventable cause of seizure disorders and of epilepsy in the developing world. And so we are trying to make progress, which has been slow so far, on the intensified control of Taenia solium. The reason for it being slow has been due to the fact that there has been very few resources and tools in this area of work. However, over the past few years, we're happy to say that we have picked up momentum, and this has been catalyzed in a great part by the donation of Bayer to WHO and to the countries through their donation of niclosamide and praziquantel. And as you know, with Taenia solium, this is not an area of work we can do on our own. We work very closely with the different sectors and the disciplines to actually get the best bang out of our buck. And so there are opportunities for synergies here. For example, with preventive chemotherapy, we can use the synergistic approaches and opportunities when we are doing preventive chemotherapy, for example, for schistosomiasis. There are opportunities also from the mental health discipline that we can strengthen our universal health coverage efforts to reach those in need for mental health due to cysticercosis. And of course, we're happy today to also have the sectors that are part of our One Health momentum to also be tackling the problem of Taenia solium at its source. Through prevention, we can actually break the cycle of the parasites by treating pigs through vaccination or deworming. So we need a coalition of partners to actually get the work done. And so today, you will become familiar with a couple of tools that we have prepared, and we will present to you briefly. They will be available either online or through your WHO regional focal points. We have tools to assist countries to map and identify high-risk areas. And we have forms, for example, for requesting the medicines. And we have 2 guidelines that we will highlight today that are fresh from the press, that are already online and ready to be used by countries. And with that, it takes me to the next part of our agenda, which is to introduce our regional focal points, who will give an overview of the situation in their regions. And with that, I will start with asking Pauline Mwinzi to take the floor. Pauline is a technical officer for schistosomiasis and soil-transmitted helminths in the expanded special project for elimination of NTDs in the WHO region of Africa. She's also serving as a focal point for teniasis and has over 20 years experience working in NTD research in Africa. So, Pauline, you have the floor.
Thank you very much, Bernadette, for that introduction. And thank you for the slides. I see they're already loaded. I'm very glad to give the update from the Africa region, which we're coordinating from this level from the expanded special project for elimination of NTDs. Next slide, please. So in the Africa region, we have up to 27 endemic countries, and 11 countries are suspected to be endemic. And the map I am showing here that paints a picture of what I just mentioned is limited in the fact that it is at the national level, while many cases of the disease will be in specific areas, in certain areas, or in certain communities. Next slide, please. And so for that reason, for the disease being in certain areas and in certain communities, in many of the cases, mapping at subnational levels is what is urgently needed for us to understand better the endemicity. In terms of what's going on in the region, we have many research projects that have been implemented in different countries in Africa on the human and animal side, but very few countries have national or subnational control programs in place. And this is where the biggest gap is. And so in the next few slides, I will present just some of these examples of the interventions in the 3 broad categories of approaches, this being a zoonotic disease. And I will start with human interventions, and I'll give an example of the project in Madagascar that was running for 3 years between 2015 and 2017, which was one of the largest interventions that we've seen so far. Approximately 70,000 people were treated every year, and it was very successful in decreasing Taenia prevalence, but was not sustained for the long term, as we know of many other neglected tropical diseases that have an environmental link to the transmission, or zoonotic link as well. And so the table here shows how after the 3rd MDA, the prevalence was very low, but 16 months later was back almost to the regional levels. Next slide, to the original levels. Next slide, please. The next example I will give is that of pig vaccination trials that have been successfully conducted in Cameroon, Uganda, and Tanzania. Currently, we have a vaccination and treatment campaign in pigs that is ongoing in the Eastern Cape of South Africa that is led by AfriVed. And we are very happy to mention this because it shows a very successful public-private partnership. And what's ongoing is legal palpation that showed a prevalence of up to 5%. We have 200 pigs that have been vaccinated, and local vets conduct monthly visits in these targeted areas. Next slide, please. And then we present an example of a One Health project, and this is a combination of human and pig interventions. I'm giving the example that's already been published by Gabriel and others in the last year. It's a recent project conducted successfully in Zambia, targeting around 1,000 people and 200 pigs. We had mass drug administration with praziquantel among the people, pig vaccination and treatment, and education campaigns in the communities. This project is similar in protocol as another large One Health project conducted in Peru. And you will note, as indicated there, that there were it was conducted 6 times every 4 months, which, as you can imagine, is very resource intense and may pose a challenge implementing in other areas, and you know, especially when we have resource constraints. And so, in the next slide, I'll show the current ongoing project in Madagascar, a large One Health minimum input project that has started here in this country, funded by the Livestock Vaccine Innovation Fund of the IDRC, implemented locally in the country by FOFIVA, the Ministry of Agriculture, Ministry of Health, with the support of IOC, and our technical support and other support from the WHO and the University of Melbourne. So in Madagascar, we're currently targeting a population of about 190,000 people in 2 provinces, and a pig population of 45,000 pigs, so quite a large project. The interventions include 2 vaccinations in young pigs, which will start and end in September 2021, and 1 mass drug administration activity with praziquantel in November 2021, and we will have the final evaluation in 2023 after the annual activities. So we are really looking forward to the results from this particular project, as we think it sets really the base for other similar programmatic activities in countries. Next slide, please. And so I'll end with just presenting the opportunities in the region. It really is time to move all of this experience and research projects and all of what we know to programmatic level, where we can then begin to focus on control and elimination within the ministries of health. And we have lots of opportunities. Many countries have already some level of experience working on T. solium. The disease is present in different epidemiological settings. In some cases, probably localized in small settings or communities. And as I already mentioned, mapping is the most urgent activity, and that's mapping at subnational levels. And then we have the opportunity where we do not have specific T. solium, focal points and departments. We have the opportunity to collaborate with other programs, such as the schistosomiasis and soil-transmitted lambidiasis programs, and to ride on what is already going on there. These have a very strong links at community levels, and we should be able to ride on such activities. And then we have the new tools that we are launching today, and medicines is already being availed from the pharmaceutical donor. And already in 2021 we did ask countries to share their projections from the Africa region, and we've received this from several countries. So I'm really looking forward to working with all of you. Thank you for joining us today, and thank you for listening to me. Over to you.
Thank you very much, Pauline, for a very clear presentation, and also for the enthusiasm you are bringing to the program in the Africa region. With that, I ask Farah to please upload the presentation of the Americas, the region of the Americas. So we will have a presentation from the Americas on their progress. It is Ana Lucianes will provide the presentation. She's works in the Neglected Infectious Diseases Group in the Pan American Health Organization. And as all our focal points in the different regions of WHO, supports the promotion, the implementation, and facilitation of technical cooperation with member states. on the control of multiple NIDs and Taenia in specific. So we'll have Anna's presentation.
Good morning, everyone, and thank you for the opportunity of sharing with you the work made on the control of Taenia solium in the American region. My name is Ana Luciáñez, and I am a regional advisor on neglected infectious diseases for the Pan American Health Organization at Washington, D.C. In PAHO, Taenia solium is included in the framework for the elimination of neglected tropical diseases and other infectious diseases in the region, launched in September 2019, with the goal of eliminating over 30 communicable diseases and related conditions, such as open defecation, prevalent in the Americas by 2030, ensuring that no one is left behind. In PAHO, we have 14 Taenia solium endemic countries, 1 suspected endemic, and 4 with few peaks with risk factors. As already mentioned, the limitation of this map is that it is at country level, and in many cases, the diseases will be limited to certain areas or communities. Many endemic countries have already been working on Taenia solium control, but at a small level. We need to scale up and expand to all countries. Here you can see some example of educational material used in Mexico for the control of Taenia solium. Several countries have conducted the mapping and participated in the process to develop the mapping tool. But many countries still have to conduct the mapping at subnational level. This is an example of mapping in Guatemala in this picture on the slide. Some countries, such as Honduras, have been using preventive chemotherapy in affected communities. PAHO has led the development of the guidelines for the implementation of preventive chemotherapy for teniasis, that you will hear later more in detail about this guideline. PAHO has also developed and published in 2019 a manual and an online course that explains the different tools available for the control of Taenia solium and gives the operational guidelines to develop a control plan of Taenia solium. Here you have the manual and link for the online course. The course has had so far over 7,000 participants. And what opportunities we have in the region? To conduct the mapping at subnational level and use lessons learned of countries that already implemented this mapping at local level. To expand existing programs thanks to the new drug donation and PC guidelines. Use the expertise in the region and technical documents to guide on the implementation of activities. And also we have countries committed to comply with the framework for the elimination of neglected tropical diseases and other communicable diseases in the region. Thank you very much for your attention, and I hope you enjoy the rest of the webinar. Bye.
So thanks to PAHO for providing us that video. We do acknowledge that the resolution and the acoustics is not perfect, but we hope that will be improved over the time of our webinar. And now I would like to call to the floor Supriya Varusavitana. She's our regional advisor in the WHO Eastern Mediterranean region. And she has worked with WHO for many years at the country level, but also at different regional levels. And she has been working not only in the neglected tropical diseases field, but on multiple communicable disease control programs and humanitarian responses. So Supriya, you have the floor.
Thank you, Bernadette. I cannot switch on my video because it gives some message that the host has stopped the video sharing. Anyway, it's fine. You can hear me, Bernadette?
Very well, thank
Yes.
you. And we'll
Thank
ask WHO IT support to help us with the video and with the.
Okay,
Please,
I think now I can.
Yes,
Yeah,
there you are.
okay, that's fine. Let me share my presentation. You can see my screen?
Yes, but it's
Yes.
not on, it's fine.
Yeah.
We'll go
Yeah.
with your screen as it is. Go
And
ahead.
let me share, I do the
Yes.
slide presentation. Now it's fine, yeah?
Yes, perfect. Thank you.
Yes, thank you.
Right.
And thank you, Bernadette, for your kind introduction. Good morning, good afternoon, and good evening, everyone. I will do I have a very brief presentation on the Taenia solium update for the WHO Eastern Mediterranean region. And you will understand why my presentation is very brief from my next slide. So there are 22 countries in the WHO Eastern Mediterranean region, and all the 22 countries are Islamic countries. There are a few countries with a small percentage of population following other religions other than Islam, and they are Egypt, Lebanon, Morocco, Somalia, and Tunisia. And these are the countries which have been reporting a very small number of pigs. But in most of these countries, these pigs are in the commercial farms. So the Taenia solium infection is almost not prevailing in most of these countries. But there are a few countries which also have a free roaming pigs. Example, Egypt. In Egypt, there are 2 governorates which have reported having free roaming pigs in the slums, rural and peri-urban areas. And they reported the Taenia solium infection. And in some occasions, they also request WHO the medicines for the treatment. So the Taenia solium infection in the WHO Eastern Mediterranean region, the burden is almost insignificant. But still, there are opportunities to identify the affected communities and work with them to further reduce the infection and finally eliminate it. Thank you.
Thank you, Supriya, for a clear intervention there. And yes, these are the opportunities. If there are small communities, those are the ones we can have rather quick results in. So thank you very much for that. And now I would like to invite Elkan Gazimov to take the floor and share his screen. Elkan is a technical officer in the WHO European region, and he is responsible for malaria and neglected tropical diseases and other vector-borne diseases in his region. He has worked in multiple offices of WHO, both in country and the regional office, so he understands very well the situations that countries are grappling with. So over to you, Elkan.
Thank you very much, Bernadette. So can you see my screen?
Yes, very well. Thank you, Elkan.
Thank you very much. Thanks a lot. So first of all, dear colleagues, I would like to say a few words about the European region. It covers a huge area, consists of 53 member states with the population of over 900 million. And the regional office is based in Copenhagen. We have also technical centers in 5 countries. We call them GDOs, geographically dispersed offices, and they are responsible for different areas. For example, in Bonn, we have office responsible for environmental issues, in Venice on health determinants, and etc. And we have country offices in 30 member states. In terms of Taenia cysticercosis, I would like to say that in many European countries, they are reporting zero cases. However, the issue, I think, should not be underestimated because these factors for parasite transmission are still in place, and I will describe them in the next few slides. So there are countries with high number of pigs. However, the majority of pigs are commercial indoor pigs that are not risked for Taenia solium. There are commercial outdoor pigs, but they tend to be in the field and not roaming in the community. Porcine cysticercosis reported to IE from several countries, but probably sporadic in most of them. And about human Taeniasis cysticercosis, I will talk about a little bit later. Now, talking about risk factors, the second risk factor is open defecation. It is in the European region is negligible, except two countries, Turkey and North Macedonia, which according to the report, 1 and 2% of the total population practice open defecation. But in some rural areas, they use unimproved sanitation facilities, more than 5% of the population. And I will also show this in figures. Now, as you can see from this picture, you see here the number of pigs in different countries. And even though we have also Muslim countries such as Turkey, such as Armenia, but also in Central Asia, Kazakhstan, Kyrgyzstan, there are still not a lot, but still a population of pigs. And these two countries, North Macedonia and Turkey, I mentioned the practice of defecation. And in the rest of the region, it is indeed negligible, less than 1%. But in more countries, they use unsafe sanitation facilities or unimproved sanitation facilities. Porcine cysticercosis are reported to OIE only in two countries, in North Macedonia and Romania. Now, about human cases, I have to say that, unfortunately, in the European region, at the regional level, WHO regional level, surveillance of human Taeniasis cysticercosis are quite weak. And we just started dealing with this only recently. And just imagine that we included data on Taeniasis cysticercosis in our annual data collection form only 2 years ago. So we started receiving data, but they are not that solid, so still not that solid, so I cannot present them. But what I can say that in the western part of the region, in many countries of the western part of the region, Taeniasis cysticercosis is not even a notifiable disease, and it is not under national surveillance, so the data are not collected or not reported, and they just leave this table blank. In other part of these Western European countries, the disease is under surveillance, but they report 0 cases. And there is a third group of countries where the data is under surveillance, and they report some cases, a human case. I'm talking about human cases now. And these countries, for example, was for 2020 data we have received already, Armenia, Belarus, Kazakhstan, Russian Federation, Slovenia, UK, they reported few human cases of Taeniasis and or cysticercosis. Now, what is the conclusion here? That sporadic cases of porcine cysticercosis reported in a few countries, sporadic cases of human cysticercosis reported in a few countries also, but active transmission cycle of the parasite probably present in a few countries, only in a few countries and very sporadically, and this provides opportunity for control and elimination. And our goal as a regional office is to improve that surveillance and to have to collect necessary for us data to take necessary actions. Thank you very much. That's it from my side.
Thank you, Ilkan, for showing us the importance even in your region of Taenia solium, and we look forward to working with countries to start to scale up some of our efforts in the control of Taenia solium. And so with that, I will now move on to the Western Pacific region. I ask Aya Yajima to take the floor and share her screen. Aya is the focal point for neglected tropical diseases in the WHO Western Pacific regional offices, and she coordinates very closely with us in the headquarters and multiple country offices and donors and partners in really trying to promote this work and starting the work in some of the very affected countries. Thank you, Aya, for joining us. You have the floor.
Thank you for the opportunity. So Western Pacific region is one of the most diverse regions, highly advanced countries, including highly advanced countries like Japan, Australia, Korea, and countries with a dense urban population, and also geographically very scattered small Pacific island country with population as little as 10,000. And within this region, we have 28 countries and areas endemic for at least one entity. And generally, T-solium burden data is also limited in our region. But there are data to show that China, Vietnam, Cambodia, Laos PDR, and Philippines are endemic for T-solium. And Malaysia also has some limited data to indicate possible transmission, at least in some communities. But in the Pacific, there is almost no information available. Nonetheless, we know that some of them, the Pacific Island countries, also have a considerable number of pig population, and the risk factors are present. But it is also possible that parasite has never been introduced, so we still don't know. So the journey to control teniasis and cysticercosis in our region was accelerated in 2017. So we organized an expert consultation in Korea to review the burden and endemicity of foodborne trematose and also teniasis and cysticercosis in the region, and so discuss the recommended strategic, programmatic, and research priorities. So in this meeting, we identified the countries where completing disease mapping is a priority, and also where there is sufficient data is available to initiate already a One Health intervention. So in the following year, we shared this outcome at the entity program managers meeting in Manila to encourage implementation of the recommendations at the country level. And in 2018, in order to facilitate multisectoral collaboration for control of neglected parasitic zoonosis, including teniasis and cysticercosis, so we, together with FAO, OIE, and the CRO, organized a tripartite meeting to accelerate prevention and control of those diseases in Asian countries. And the meeting brought together different sectors involved in the prevention and control of parasitic foodborne zoonosis together, including the focal point of NTDs, animal health, food safety, and water and sanitation from those countries. And the meeting discussed priority diseases and also actions in each country, and also made some of the recommendations to the OIE, FAO, and WHO tripartite at the regional level, including the continuation of a facilitation for multi-sector collaboration in the country level, and also to provide technical support and also the guidance for facilitating the cross-sectional collaboration for control of these diseases. So in response, from 2019, the tripartite continued to work together to develop a series of guidance and communication material to accelerate control of foodborne parasitic zoonosis, including teniasis, T-solium teniasis. And this includes one-pagers targeting public health practitioners on foodborne parasitic infections. And also we collaborated with FAO to develop the food safety booklet targeting for the Food Safety Authority for prevention of the foodborne parasites. And we also have a current ongoing collaboration with OIE and FAO on the development of handbook, poster, video for veterinary practitioners on the food parasitic zoonosis control. And we also have been collaborating with headquarters countries, mainly accelerating mapping of T-solium teniasis. So this including the support to Laos to initiate disease mapping, and where the stool sample collection was actually integrated with the STH survey. And also we are helping the PCR testing for specimen confirmation supported by the University of Melbourne. And we have also been supporting the Cambodia and provincial Katoka training, including the diagnosis of teniasis, and also supporting T-solium risk mapping using this new WHO mapping protocol in Cambodia and the Philippines, and also a PCR diagnostic being validated in Australia and the Philippines. So this is the progress so far in the region, and for the way forward to progress, the priority includes progressing disease mapping and to identify all risk area needing One Health intervention, and to really initiate One Health intervention in this area, including MDA for human and for the treatment and vaccination for pigs. And also, it's important to ensure community engagement for the enhancing hygiene and food safety behavior, not just giving the medication to the animal and the human. And we have a good opportunities in our region. We have a number of integration opportunities with other ongoing PC programs, such as STH surveys, as I mentioned earlier, or regular deworming. And also we have a very good progress in community-led NTD WASH collaboration for elimination of schistosomiasis in some of the countries that can also integrate food safety aspects. And we have a growing diagnostic capability in countries. And also we have a very strong collaboration with FAO and OIE. So we hope to continue our support to the country. Thank you very much.
Thank you very much, Aya, for a very clear presentation and for all your energy in the region in really encouraging countries to get on board in the control of teniasis. And just before we move on to the presentation from OIE, I would like to highlight that we have limited time in this webinar, so we won't be really going into a lot of detail on WASH and education and awareness, acknowledging that these are really very important perspectives in the control of Taenia solium, but we'll have opportunity in the future to highlight these perspectives and bring them more to the forefront. And with that, I'd like to invite Gunalan Pavade, who works with the World Organization for Animal Health and the headquarters in Paris as a scientific coordinator for multiple areas, especially in the administration of the Secretariat support to Biological Standards Commission, and also in the administration of the OFLU network, which is an OIE FAO network on animal influenza. Gunalan, you have the floor.
Thank you, Bernadette, for the introduction. So I am not able to switch on my video, but anyway, I will share my screen to show off my slides. Okay, so you could see me now. So I am Gunalan Pavade, as introduced by Bernadette. I working in the OIE in the science department. So as you all heard from these presentations, the role of pigs in this cysticercosis as a zoonotic disease. So I will be from the animal side, provide some of the tools that are available for the control of Taenia solium in pigs. So the outline of my presentation, I will provide some overview of some of the OIE international standards, and specifically touch some of the terrestrial manual standards available for Taenia solium, and also from the terrestrial code standards available for Taenia solium, and how the Taenia solium can be notified to OIE. So as you all know, OIE is an intergovernmental organization for improving animal health and welfare worldwide. So for this purpose, OIE sets international standards to support member countries in their efforts to prevent and control animal diseases, strengthen the veterinary services, and facilitate safe international trade. So for these purposes, we have two international standards. One is the codes and the manuals. So it deals with both for the terrestrial animal diseases as well as for the aquatic animal diseases, both in the code as well as the manual. The terrestrial manual is mainly provides information about the internationally agreed diagnostic tests and also how to produce vaccines. So this contains information in the terrestrial manual as well as the aquatic manual. So when it comes to the terrestrial code, it provides the standards for the improvement of animal health and veterinary public health worldwide. So these standards are used by the veterinary services to set up measures for the yearly detection, reporting, and control of various pathogenic events, including Taenia solium. So now I will move on to the terrestrial manual standards on Taenia solium. So as you all know, Taenia solium is a zoonotic parasite of pigs and also occasionally other animals. So we have specifically a chapter 3.10.3 cysticercosis, including infection with the Taenia solium in the Terrestrial Manual. So this is available online access. When you visit the OIE website, you can go to the Terrestrial Manual online access, and you can find in the chapter, the whole chapter that provides the international standards of the internationally agreed diagnostic tests available for the Taenia solium. So this porcine cysticercosis always available primarily in the muscle and the central nervous system, and is caused by the metacystodes, which is the cysticercus of Taenia solium. So as you all heard in this webinar, it is an One Health issues because of its zoonotic potential. So for the diagnosis of the agent, mainly the meat inspection is one of the standards that is normally followed worldwide. So the metacystodes may be palpable in the tongue of an infected animal pig and detected usually during the postmortem examination or meat inspection of various tissues. So usually the tongue inspection consists of the main diagnostic procedures used by the pig traders in endemic and resource poor areas. However, this is only of diagnostic values in pigs heavily infected. And also the meat inspection can be done. So when you visit the OIE online access of the manual, it gives a detailed procedure how the meat inspection can be done. However, this meat inspection is not also sufficiently sensitive to detect all cases of porcine cysticercosis, example like pigs which are lightly infected. So there are some serological tests available for detection of the circulating antibodies. However, they have little role in pigs except for the epidemiological significance. So we have an antibody detecting test, enzyme-linked immunoelectrotransfer blot, which is available for the diagnosis of Taenia solium cysticercosis in pigs, though the diagnostic performance is limited because of a high false positive rate. And also there is some serological test available for antigen. A commercial test in the form of ELISA is available for the detection of the circulating parasites derived antigen in the serum of pigs with the T. solium cysticercosis. But again, here the use is limited due to a high false positive rate and low positive predictive value. So the pig vaccines and treatment, the vaccine based on the recombinant antigen is mainly used for the porcine cysticercosis for use in pigs. The vaccine has been evaluated in experimental studies and field in few countries and achieved 99 to 100% protection. The TSO18 vaccine targets the parasites during its early development in the pig and does not affect the cysticercosis if they are already established in the tissues prior to vaccination. So the use of vaccine is recommended along with a treatment of expendazole, single dose 30 milligram per kg, where the drug clears any pre-existing infection and the vaccine prevents infection from any subsequent exposure to the parasites. The pigs of 2 months of age or older are immunized by intramuscular injection with 1 ml of this, and a booster dose is also required after 3 to 4 weeks. So at least we requires 2 vaccinations. Then we have a terrestrial code chapter on T. solium. This chapter provides infection recommendations that are useful for the prevention and control of T. solium in pigs. So here you can see when you visit the same online access, you will see all the measures that are available to prevent and control of infection with the T. solium. Usually the prevention, how to control at the animal source, prevention and control of infection in pigs by community awareness, education programs by authorities, how the surveillance program can be conducted in pigs. So we have this information in the terrestrial code. And also there are recommendations for the importation of meat and meat products. What are all the conditions that has to be met when poultry, meat or meat products are imported. So these are all the conditions, recommendations are available in the terrestrial code. And also there are procedures for the inactivation of T. solium cysticercosis in meat of pigs. So the Terrestrial Code Commission in its September meeting in this month will again consider incorporating the recent updates. As I told you in the recent update, we included the vaccine availability and how it is available. So this will consider how to incorporate this recent update in the manual in the terrestrial code regarding the vaccines. So as you all know, T. solium in pigs is an OIE listed diseases and has to be reported to the OIE through a World Animal Health Information System. So this is a unique comprehensive database which contains the information about various pathogenic OIE listed diseases and gives an information about world animal health situation. So you can visit this OIE website and go to the OIE WAGIS database, where you can find all the reports for porcine cysticercosis, which is helpful to understand the disease situation in a region or country. So finally, I would like to know that our regional offices of FAO, OIE, and WHO in the Asia Pacific, they are developing a handbook. You can see the poster as well as the poster targeting the animal health sector for the role of veterinary authorities and animal health practitioners in preventing and controlling the neglected parasitic zoonosis, and a poster you can see how the porcine cysticercosis happens and this transmitted to humans. So this will be coming soon. So it is in the final stages of finalization, and these materials highlight the importance of the multisectoral One Health approach to prevent and control neglected animal diseases. So finally, I thank you all for your attention. Don't hesitate to visit the OIE website. As I mentioned here, you can see the OIE website. And also we have regional offices in Africa, Americas, Asia, Europe, and Middle East. So you can see the website address of all these addresses. So don't hesitate to contact OIE for any information on this. Thank you.
Thank you, Gunalan, for a very excellent presentation and also for the excellent progress that has been taking place over the last few months on the code, on the standards, and we're really looking forward to this new suite of awareness raising materials, especially for the veterinary sector. And we look forward to then working with you and FAO to actually implement some of these prevention methods with countries, and also perhaps look into assisting them with acquiring the tools like vaccines and the drugs to support the treatment of pigs. Thank you very much, Gunalan.
Thank you. Thank you.
And now I would like to invite Dr. Masami Takashi from the Food and Agricultural Organization of the United Nations. She's been working in the Food and Agricultural Organization for many years and brings a lot to bear on scientific advice to countries and also to the Codex Alimentarius Commission. Her main responsibility is in the area of food safety risk assessments that deals with both emerging issues and technologies and cross-cutting solutions. So over to you, Masami.
Thank you very much, Bernadette. Greetings to everybody. I will start off from this food safety perspectives. We have collaborated with WHO on various different food safety topics, and we provide scientific advice to the Codex Alimentarius Commission, which is the international
We seem to be having some interruption of the audio. I'm sorry about that. Today is not our day with the platform. Masami, we cannot hear you. So we'll try that again. Masami, we were having problems with your audio. We can offer to upload your slides if you like, just in case that is causing a problem. Masami? So until we get Masami back, let's move on to the next speaker, who is my dear colleague and actually really the driver of a lot of the work on Taenia solium at the World Health Organization and beyond. She is a senior fellow at the University of Melbourne, Sheldon Do, and works as an independent consultant for several organizations, including us at the World Health Organization, and of course also for the OIE. Marichelle is a veterinarian specializing in the interface between animal health, public health, and development. And she has worked both in the commercial and non-profit sectors, and also in the development of vaccines and medicines and diagnostics for livestock diseases. Marichelle, the floor is yours. Over to you.
Okay, thank you very much, Bernadette. Can you see my screen and can you hear me properly?
Yes, very well, thank you.
Okay, so thank you very much and good day, everybody. It's a big pleasure for me to be able to introduce to you this new tool for the identification of endemic and high-risk areas. And this is very important because if we want to initiate a control program, we need to know where to start. And as you have heard from many of the regional presentations, we are still missing subnational and detailed data for many countries. So that's why we have been working with some countries in developing a very simple mapping protocol and an Excel tool to help identify these areas and assign the risk. We have also developed a video to provide more details and to guide you step by step in the use of this protocol and this Excel tool. So how does it work? Well, the first step is to collect all the relevant information regarding the diseases, that's Teniasis, human cysticercosis, and porcine cysticercosis, and also about the key risk factors, the open defecation, and the presence of pigs roaming in the community. And it is important to collect the data not only from publications, but also from other sources, for example, from abattoirs, or for example, data from cattle-cat surveillance for other NTD programs, or from local butchers, etc. That's important to be creative and try to find as much information as possible. Then the next step is how we organize and categorize the risk. And here is where the Excel tool can be very, very useful. So this tool, we can use it at different administrative levels. You can use it at province, district, community, villages, whatever, it's more convenient for you. Then we need to mark the presence of the disease. And here we are only indicating the presence because we know that it's a neglected disease and we are missing a lot of information, so we are not expecting to have prevalence or percentages. So just the presence of the disease will be enough at this point. Once we have entered the data, then we can click on define the risk level, and the Excel tool will automatically assign a risk level between 1 and 6. 1 and 2 is high risk level when there's an evidence or high likelihood of active transmission of the parasite. 3 and 4 is when there's a moderate risk, and 5 and 6 where there's lower risk and the active transmission of the parasite may or may not be present. Once we have assigned the risk to the different areas, we can also click in sort by risk, and the program will automatically select the areas in order of risk. Some of you might prefer to show the information in a map. Unfortunately, the program doesn't have the mapping capability, but nowadays on the internet, you might have some editable maps. And in some cases, some of the WHO regional offices might be able to help you with the map. And once we have identified the areas with the high risk level, then we need to confirm the endemicity. For that, we can look into the human side on the animal side. On the human side, probably the most practical and feasible nowadays is the cattle-cats, and there's where there can be synergies with other diseases such as schistosomiasis. And we just need to identify the eggs of Taenia, but then we need to confirm the species. We can also confirm endemicity looking at the animal side and confirming porcine cysticercosis. Once we have confirmed endemicity, then we can start with the control program. Now, it's very likely that the information that we have collected is limited, because as I said, it's a neglected disease. So it is possible that some areas might not have been classified properly. And so we are very aware of that. And that's the reason the Excel tool has been designed in a way that it's very easy to update. So if you got more information, then you can update the information and you can reassign the risk level. So if you want more details, I really encourage you to contact your WHO country office or WHO regional office and really look at the protocol, play with the Excel tool, and hopefully you find this a useful tool to help you in the mapping of Taenia solium. So thank you very much and good luck in your efforts for Taenia solium. Thank you.
Thank you, Marichelle, for a clear presentation, and that we have these tools now to actually start to get a baseline for countries to prioritize where they should start the work. Thank you very much for that. And we do have Masami back. I will ask Masami to take the floor and take 2. Masami, you have the floor.
Okay, thank you very much. I don't know until what point everybody was able to hear me, but then I hope that you can see my screen. Not yet. Can you see my screen? No.
We can see your screen. It's not on presentation mode, but that's fine. I think we'll just
okay.
go ahead.
It should close then. Okay. There you go. No, somehow it is not working. Let's see. I will use the PDF then. Okay. All right. Sorry about that. Now it should be working.
Yes, we can see.
Okay, very good. I should do a full screen. Okay, anyway, I will use this small screen. Sorry about that.
It's
now
okay,
that yeah, hopefully that it is readable still.
Yes.
Basically that where I left out, I don't know where, but then I was trying to explain that we have a codex, and then FAO and WHO collaborate to provide a scientific advice, and risk ranking on the foodborne parasite is requested by the codex. And then expert meeting was conducted, and then the result was saying that Taenia is the #1 risk in the ranking, multi-criteria based ranking from the expert opinion elicitation. So we have 2 publications developed at the time. And then I already explained that in the Asia Pacific region that we had developed this booklet for the Food Safety Competent Authority. And then various practical recommendations have been made from the previous speaker, Marichelle. And then biggest thing in food safety is that this lack of awareness from the consumer side. And then we really realize that the communication and advocacy effort is necessary. Therefore, that FAO would develop this food safety infographics for consumers. And then it is not technical at all, but then we try to have a layman's language to describe that what could be the points that the consumer can focus on. So I will stop there. I don't want to take any more time, so I will stop here. So questions should be in the chat box, or I'll be very happy to answer at the end. Thank you very much.
Thank you, Masami, for always being there to make that really important link between Taenia solium and food safety, and bringing it also to the global visibility through Codex and other ways. So thank you very much for that. And with that, we'll move on to a recorded message from Professor Teresa Giorgos, who is professor at the Department of Epidemiology, Biostatistics, and Occupational Health in the Faculty of Medicine and Health Sciences at McGill University in Montreal, Canada. She participated in developing the current WHO guideline for soil-transmitted helminths, and she is the director of the WHO Collaborating Center for Research and Training in Parasite Epidemiology and Control. And she also co-chaired the guideline development group for the Taenia solium guideline, which you will be hearing about a little bit later during this presentation. So if we can have the video, please.
Thank you.
Hello, everybody. It's a pleasure for me to share with you today the new WHO PAHO guideline for preventive chemotherapy for the control of Taenia solium taniasis. This guideline was prepared in accordance with the latest WHO methods for guideline development. It included the following process. First, a guideline steering group managed the entire process. There was a systematic review group who synthesized the cumulative evidence on taniasis and its treatment to date. There was a guideline development group who developed the recommendations that I will be sharing with you today. And an external review group looked at those recommendations and provided their appraisal for the final version of the guideline that I am sharing with you today. It's important to note that different regions of the world and expertise are represented in these expert groups. The official citation is the following. It's the WHO guideline for preventive chemotherapy for the control of Taenia solium taniasis, published this year. So the systematic review group summarized the evidence to date on the following two questions, which inform these guidelines. The first question was, should preventive chemotherapy with niclosamide, praziquantel, or albendazole at any dose or frequency versus no preventive chemotherapy be used for the control of taniasis by Taenia solium in endemic populations? And secondly, in school-age children who live in areas co-endemic with T. solium and soil-transmitted helminths, could preventive chemotherapy for both these parasites be given simultaneously? The systematic review has been published in PLOS Neglected Tropical Disease last year, and of course is available to all of you to look at. The recommendations that I am going to share with you are all conditional, and they're conditional because in the systematic review, the evidence that was summarized are consistent with having a very low certainty of the evidence. So as more evidence is gathered, further updates will be done. And this is really an important point, is that we do need research on many different aspects of Taenia solium taniasis as we move forward. There are 4 recommendations. The first recommendation is that preventive chemotherapy using niclosamide at 2-gram dose, adjusted for children, can be used as a public health intervention for the control of Taenia solium taniasis in endemic populations. That's the first recommendation. The second recommendation is that preventive chemotherapy using praziquantel at 10 milligram per kilogram body weight can also and is suggested as a public health intervention for the control of Taenia solium taniasis in endemic populations, ensuring that there is a reporting system in place with active surveillance and medical referral of neurological adverse events. The third recommendation is that if neither niclosamide nor praziquantel is available, preventive chemotherapy using albendazole at 400 milligram per day for 3 consecutive days could also be considered as a public health intervention for the control of Taenia solium taniasis in endemic populations, again, only if a reporting system is in place with active surveillance and medical referral of neurological adverse events. The fourth and last recommendation is that in school-age children who live in areas co-endemic with Taenia solium and soil-transmitted helminths, praziquantel for taniasis at the dosage of 10 milligram per kilogram body weight and albendazole for soil-transmitted helminths at a dose of 400 milligram single dose can be considered to be given simultaneously to promote synergies of the programs, ensuring that a reporting system is in place with active surveillance and medical referral of neurological adverse events. There are some subgroups that need to be considered. The first is children. The dosage of niclosamide should be adjusted for children under 6 years of age. If albendazole is to be used, albendazole for taniasis at 400 milligram per day for 3 consecutive days should not be used in children under 30 kilogram weight. Another subgroup are people with symptoms compatible with neurocysticercosis or subcutaneous cysticercosis. These people who have these symptoms should be excluded from preventive chemotherapy with albendazole or praziquantel. It's important, however, to be aware that excluding people based on symptoms doesn't necessarily address the potential risk of precipitating neurological symptoms in individuals who have asymptomatic neurocysticercosis at the time of treatment. Another subgroup that must be considered are those of pregnant women, including pregnant adolescent girls who are in their first trimester of pregnancy, or women who are suspected to be pregnant. These women and adolescent girls should be excluded from preventive chemotherapy for taniasis with any drug. The following implementation considerations are also important. First of all, the scope of preventive chemotherapy should be considered for the entire community, not for just a part of the community, but the entire community. So the program really must be inclusive of the entire community. With respect to food and drink, praziquantel and albendazole for taniasis should not be given with food. So ideally, these drugs should be administered at least 2 hours since the last meal and 30 minutes before the next meal. Praziquantel and albendazole should also not be given with grapefruit juice. There are some considerations with respect to the choice of drug. So the choice of drug for preventive chemotherapy for taniasis should consider the presence of other co-endemic diseases that might benefit from the preventive chemotherapy program that is being implemented. The choice of drug also depends on drug availability, acceptability, affordability, and feasibility of implementation. And keep in mind that some drugs for preventive chemotherapy for taniasis may be available through WHO, and you should inform yourself of this case. The choice of drug should also be informed by epidemiologic mapping of cases based on both animal and human surveillance data. With respect to adverse events and reporting, active surveillance of adverse events should be conducted for at least 3 days following preventive chemotherapy for taniasis with either praziquantel or albendazole. That is 3 days after the last dose that has been administered. And this should be followed by passive surveillance for another 7 days. The people in the healthcare system at the community level need to be trained in the recognition, reporting, and management of neurological side effects. In this regard, the National Program on Epilepsy and other epilepsy initiatives could be included as collaborative partners to undertake this training. Routine data collection procedures are required with respect to the standard reporting of coverage of the preventive chemotherapy program. This reporting should, at a minimum, be disaggregated by age and sex. With respect to messages to the community, preventive chemotherapy with any drug should be accompanied by the relevant information, education, and communication about adverse events. And of course, WASH messages, water, sanitation, and hygiene messages, especially with respect to the safe disposal of feces. Lastly, preventive chemotherapy delivery can occur in different community facilities, health centers, schools, or other appropriate facilities in the area in which the program will be implemented. And it is hoped that it could be integrated with any other public health intervention that is going on at the same time. Lastly, the research agenda is very important in order to ensure that these guidelines reflect the current state of knowledge. So with respect to diagnostics, it would be important to develop and validate new, affordable, sensitive, specific, and field applicable diagnostic tests, and to be sure that these are compared so that this can inform the best practice in the field. With respect to preventive chemotherapy implementation and delivery, it would be important to confirm and to establish thresholds to trigger the start of a preventive chemotherapy program and to end it, and also the frequency with which it should be implemented in an area. It would also be important to have some qualitative studies to identify best preventive chemotherapy practices to ensure effective program implementation. With respect to efficacy and safety of the drugs, there is still a need for high quality randomized controlled trials of different drugs, different doses, and different combinations of drugs. There should also be some study about the optimal observation times for active surveillance for adverse events. With respect to assessment, there should be an economic evaluation of the preventive chemotherapy program and acceptability issues related to the program, which would benefit all stakeholders, including the community. Thank you very much. This is the new guideline for the preventive chemotherapy for the control of Taenia solium taniasis. Thank you.
So that was a very clear presentation from Teresa, which all seems so simple and so, summarized. But I just want to make clear that this is a really quite a long and rigorous process. And I'd like to take the opportunity to thank all those people who supported this work through the Guidelines Development Group, the Guidelines Review Committee, all the experts and others who have contributed to the improvement of this. And this is the first iteration. With this and other guidelines, we look forward to generating better data, more evidence that could in the future improve those recommendations, and we'll update with that improved knowledge. So with that, I'll move on now to the next part of our agenda, which will be looking at the Taenia donation and the application package. This will be done by Ulrich and myself. Ulrich Madeja works with Bayer. He is responsible for the engagement in fighting neglected tropical diseases and in access to drugs in collaboration with multiple organizations, including ours, the World Health Organization. And he has a lot, he is very much active in the international rating indices of the Access to Medicines Index. So with that, I know Ulrich very well. He has a very strong passion for public health and advancing areas to medicines, and has really had an open ear to supporting a very neglected disease, and finally has come forward with the support to member states through a donation of praziquantel niclosamide. Over to you.
Thank you, Bernadette. I really appreciate your nice introduction, and I hope I can live up to your words. At least I will try my best.
Ulrich, we have a little bit of disturbance in the line. You're breaking up.
Okay, is it better now?
Yes.
Okay, so I have to adjust my voice, obviously. Yes, Bernadette, thank you very much for this nice introduction, and I hope very much I can live up to your expectations. Nevertheless, I really feel great about Taniasis programs now taking up and coming to speed. First of all, also, of course, hello to everybody, regardless where you are. It's a pleasure to connect with you and to hear the positions of the countries. And since we just heard in the presentation before from Teresa, there is a lot that needs to be said about the products that we can use. Next slide, please. First, I would like to give a little bit of a background information. Why is Bayer actually, as a pharmaceutical company, engaging in fighting neglected tropical diseases, and specifically for the sustainable elimination? And I think I think this wording already says everything. Sustainable elimination, of course, what could be better in terms of target for sustainability strategies, the roadmap, or the achievement of the SDGs. In the collaboration for fighting entities, I'm very proud to say that we actually can look back as far as the year 2002, where we established our first collaboration with the WHO, addressing urgent medical needs in African sleeping sickness and also Chagas disease. And of course, we are well aware and take it as a part of our responsibility to ensure the best equitable access to medicines, to treatment and care for those patients that are underserved and really living in resource poor settings. After a lot of discussions that have been ongoing and postponements that have been done to actual situations, I was very, very glad that we were able to sign the first contract with WHO to provide a basis for our collaboration in fighting teniasis. And we have been able to start also the supply of products already in the year 2020. I think it's important to say that as sole manufacturers of essential medicine as Nifurtimox for sleeping sickness and Chagas disease, Suramin, we also take responsibility to ensure that actually praziquantel and niclosamide are available to WHO and WHO supervised programs as long as needed. And last not least, I think it's quite clear that you need more than just the medicines, but also need financial supports for logistics and distributions, as well as awareness, education, and training. And next slide, please. Coming to the products that are available, the products that Bayer is donating or are donated by Bayer are praziquantel and niclosamide. And I think in the last presentation we heard a lot of background information when to use which product for preventive mass drug administrations in focal disease areas. I can assure you, because I saw this question in the chat, these products are properly registered either in Europe, but also for Bilterside. We still have a lot of registrations in African countries. If there are any details required, of course, you can refer to the team of Bernadette to gather detailed information. We also heard about the dosage recommendations, which I would not like to repeat here. Now, next slide, please. Yes, as I said, our contribution to achieve the targets of the WHO roadmap are really the donation of praziquantel and niclosamide since last year. And of course, we so far have agreed on a 5-year support agreement and provide the drug at defined quantities until the year 2024. But I think with all the enthusiasm I've seen here today in the meeting, it is really an encouragement to really commit also ourselves to the supplies until 2030, seeing that here is a medical need that still needs to be addressed. We still need to have more data on the epidemiology. And of course, the initial doses that have been already delivered to WHO are just a beginning, but not a limitation. We also have the opportunity in future when larger shipments are made, they can be made directly to the countries, because similar to other preventive treatment drugs, we need to keep in mind that we have products with 3 years of shelf life, which poses the same challenges as for existing programs. And what is also important is that we work very closely together with all of you, but of course, most of all with the team of Bernadette, because our bioproduction needs a lead time of 12 months to accommodate any changes in the product supply. So with your demand creation, the verification process, and then the feedback that we are receiving on the quantities needed actually for a year, we really have to have this forecast at a well in advanced time. The financial support, of course, very much goes to logistics and distribution, as well, of course, to the program set up in pilot countries. And we are very happy to see that starting, and I'm absolutely amazed with the high quality presentations I've seen today on how such programs can take off, what needs to be considered and done. And of course, we hope that with our engagement and communication in the network, we could also encourage other partners to join the efforts. And this also refers to the animal health sector, because needless to say, we need a One Health approach where we do not only treat patients, but also vaccinate the pigs, as it has been said earlier. Thank you very much.
Thank you, Ulrich, for your clear messaging, and also for the message that if we receive requests from countries as the demand is generated, that you can adjust production to support these countries. So we thank you for considering that. And it is also a call to countries to start to think using the mapping tool, perhaps to first get a first cut on estimates of needed drugs, so that we can relay this back to the manufacturers, who can then manufacture the appropriate amount. And so I will now go on to a little bit of a description how countries can request a drug donation. So the next slide, please. So the request for drugs, as with other NTD programs or other programs, would need to be done by the Ministry of Health to the WHO country office. This is done for other diseases and will be very familiar to countries. Next slide. We have uploaded some forms for you to make the task of estimating how much product you need, and these are available on our website under Forms and Data. And if you click around the circled area, form to request donation, it will bring you to the form. Next slide, please. You will have information on how to correctly input into this form, and I will go through in the next few slides what they are. They are also available in multiple languages on our websites. Also on the PAHO website, they're available already in English, Spanish, and French, and you can use to your convenience the language you need to fill out. Next slide, please. So there are 3 forms, as I said. One is to request Taenia solium. So for countries just embarking on this program, this is the form they would need to complete, probably with the support of your WHO country office. And that would be the form that you complete on your first round. The second form next, is about the reporting. So once you have received a shipment and have embarked on a program in your country, this form is for reporting on the program. The third form is about the epidemiological data reporting, and it is really covering more information for the context of Taenia solium and the program in your countries. So those three forms are available online already now and in three languages. Next slide, please. So as you heard, we have currently only estimated a very small amount, so to speak, compared to other programs of praziquantel and niclosamide from Bayer. This can be adjusted, as you heard from Ulrich, but we need those forecasts. But we have to also make a decision who gets the drug. So we have looked at options for trying to make that decision. One is countries that have already conducted detailed mapping and have confirmed the species. Those will be the ones considered in the first provision of the medicines. The countries that have provided the forecast, and again, forecast doesn't have to be exact. We need a good estimate just to start the program, and we can adjust those over time. Countries that are continuing a program and have submitted reports and inventory. And then, of course, there are countries that are working towards elimination in a specific area. So places where there are communities where we see that elimination is actually feasible and we can reach the target. Next slide, please. So as you heard, we're looking forward to working with you. We're looking forward to receiving your forecast. We are working on the timing to receive the forecast. We know that Bayer needs these in the first quarter of the year in order to adjust their production. And with that, I will go on to introducing the next speaker on our agenda, and then have a little time for discussions with you and the panel. And the next presentation is about the WHO guidelines on management of Taenia solium neurocystic psychosis. It will be presented by Dr. Nicoline Schiess, who is an adult neurologist and technical officer in the Brain Health Unit in the Department of Mental Health and Substance Use in World Health Organization. And in this role, she serves as a WHO focal point for neurological disorders and assists in the development of guidelines for neurological disorders and other topics, such as the Intersectoral Global Action Plan on epilepsy and other neurological disorders. Over to you, Nicoline. Thank you.
Thank you, Bernadette. Just want to share my slides. Can everybody hear me okay?
Yes, we are. You're not. Yes, now you're fine. Everything.
Here? Okay, wonderful. Well, good morning, afternoon, and evening to all of the participants today. It is my great pleasure to be as the final speaker today to be able to share with you the new WHO guidelines on the management of Taenia solium neurocystic psychosis. As Bernadette mentioned, my name is Nicoline Schiess. I'm an adult neurologist working in the Brain Health Unit here at the WHO in Geneva, Switzerland. Neurocystic psychosis refers to the development of T-solium cysts in the human nervous system. This can cause seizures, hydrocephalus, chronic headaches, focal deficits, and symptoms associated with increased intracranial pressure. As everyone knows, neurocystic psychosis is one of the leading. Yes. Neurocystic psychosis is one of the leading preventable causes of epilepsy worldwide, estimated to contribute to up to 30% of epilepsy cases in areas where the disease is endemic. This can also be much higher in specific communities. In addition to these new guidelines, which I am sharing today, the WHO is currently working on several other action areas to address the needs of neurocystic psychosis. This includes the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, Ending the Neglect to Attain the Sustainable Development Goals, a roadmap for neglected tropical diseases, and mental health of people with neglected tropical diseases toward a person-centered approach. These guidelines were developed to assist healthcare providers in appropriate evidence-based management of parenchymal neurocysticercosis. The aim is to improve the decision-making to ensure appropriate patient care and avoid misdiagnoses and inappropriate treatment of patients with neurocysticercosis. The target audience is broad and includes healthcare providers working in first and second level facilities, policymakers, healthcare planners, and program managers, as well as academics and researchers in order to inform their teaching and research agendas. The methods for the development of these guidelines have been described previously in one of the earlier talks, and they were prepared in accordance with the latest standard WHO methods for guideline development. 9 PICO questions were developed to address a variety of different clinical presentations for people with neurocysticercosis. The first one pertains to the use of imaging and attempts to determine if the use of MRI as a first-line imaging technique is more accurate for diagnosis than CT scan. The following 6 PICO questions address various treatment options for people with different clinical presentations, including symptomatic neurocysticercosis with viable parenchymal brain cysts, single enhancing lesions, epilepsy, or calcified lesions. And finally, the last 2 PICO questions focus on the unique population of people who are living with HIV/AIDS and symptomatic neurocysticercosis with viable parenchymal cysts. Next, we are going to move forward with the recommendations. The first recommendation is involving the CT scan and MRI for neurocysticercosis diagnosis. MRI is the tool of choice in the diagnosis of neurocysticercosis, particularly when parenchymal viable parenchymal granuloma or neurocysticercosis of the cerebellum, brainstem, ventricular, subarachnoid, or spinal spaces are suspected. CT is the tool of choice for detecting small calcified lesions. It should be noted that CT can be used as an alternative where MRI is unavailable or contraindicated. The second 2 guidelines are for the treatment of neurocysticercosis with antihelminthic and anti-inflammatory therapy. Antihelminthic therapy, in combination with corticosteroids, should be given to individuals with symptomatic neurocysticercosis and viable parenchymal brain cysts for better outcomes in terms of cyst resolution and seizure control. Antihelminthic therapy with albendazole, in combination with corticosteroids, should be given to individuals with symptomatic neurocysticercosis and a single enhancing lesion for better outcome in terms of cyst resolution and seizure control. Recommendations 4 through 6 deal with the NCC-related epilepsy and anti-epileptic drugs. It is recommended that withdrawal of anti-epileptic drugs should be considered 6 months after the last seizure in individuals who have a single enhancing lesion and epilepsy with a low risk of seizure reoccurrence. Anti-epileptic therapy should be continued in people with a single enhancing lesion that continues to persist on neuroimaging, and those with a single enhancing lesion that resolves with residual calcification. Anti-epileptic therapy should be continued for at least 2 years in people with single or multiple calcified neurocysticercosis and epilepsy. These patients should be very closely monitored if treatment is withdrawn. The last recommendation is for the treatment of neurocysticercosis in patients with HIV and AIDS. Patients with neurocysticercosis who are co-infected with HIV should be treated according to the guidelines for treating neurocysticercosis without HIV/AIDS. In other words, these guidelines. In addition to the guidelines, we have included areas of research that is recommended to be focused on. The first one involves the diagnosis of parenchymal neurocysticercosis. It is recommended that programmatic research to increase the access of high-risk populations to neuroimaging facilities is recommended for the diagnosis of many neurological diseases, including neurocysticercosis. In areas where access to imaging is limited and costly, exploration of the use of serology as a first step in diagnosis is recommended. For the treatment of parenchymal neurocysticercosis, there are various areas on the research agenda that could be pursued. Randomized controlled trials of the optimal choice and duration for the administration of anti-epileptic drugs, definition of optimal combinations, dosing, and duration of anthelmintic and anti-inflammatory medications, determination of optimal anti-epileptic treatment and withdrawal of therapy for patients with calcified neurocysticercosis, and finally, determination of the optimal therapy and/or special considerations for people who are co-infected with neurocysticercosis and HIV. It was a great pleasure to go through these guidelines with you today, and we are happy to answer any further questions that you might have. Back to you, Bernadette.
Thank you very much, Nicolene, and thank you for all your input into these guidelines. And once again, I want to thank the big community that has helped us reach this stage of actually publishing the guidelines on the management of neurocysticercosis to the guidelines development group, to the review committee, and to all those who have supported us. So thank you to all of you. We will be translating both these guidelines, which will then become available online. This is a work in progress. And again, with this guideline, as data is generated, more research takes place, and we have improved evidence, we will be updating those guidelines with the most updated knowledge. So with this, we conclude our presentation mode, and we look forward to any specific questions you might have that you would like to provide on chat. I see that many of them have already been addressed by my colleagues, but should you have any further ones, we'd be happy to take them now. Perhaps in the meantime, while we're waiting, one of the areas that came up with was, where can we find information on monitoring of adverse events? And for this question, I'll just point to Marichal to give us, indicate where we can find this information. Marichal, would you like to take that?
Yes, sorry. Thank you. So might be important to say that the WHO has very recently published a new manual on the safety of administering medicines for NTD. So then that collates all the information that exists on the how to monitor adverse events and how to deal with them. This has just been launched, I'd say last month, a couple of weeks ago, and I will put the link in the chat because that's really a very important point, and I think you will find that very useful.
Thank you very much, Marichal. There is a question that came out on the chat, which is asking, under what should Taenia solium be categorized, under preventive chemotherapy or individual treatment of cases? I think in Taenia solium, the preventive chemotherapy side is when we treat the population level. So that's where our Bayer donation comes in, where we treat the communities of age 5 and above with either praziquantel or niclosamide. But also there is the case management side of things, which is the neurocysticercosis, which you just heard Nicolene present. And Nicolene, there's a question for you in the chat with regard to treatment if there's no MRI or CT available. Nicolene, would you like to take the floor?
Sure, absolutely. So that is a very valid and important question. And the WHO is very active right now in trying to educate more clinicians and more healthcare workers to try and recognize the signs and symptoms of neurocysticercosis. One of the things that we are trying to do, in addition to promote the use and the distribution of imaging facilities to as many places as we can, is that we are working on the intersectoral global action plan on epilepsy and other neurological disorders. And we have a specific area on focusing on the healthcare workers' capacity building, training, and support. And so the use of serology is probably the best way to help yourself diagnose neurocysticercosis if you don't have any imaging available. And yet there are other things that can cause epilepsy and can cause seizures. And so it really is important to try and get those imaging modalities out to the areas that need them. Thank you.
Thank you, Nicolene, for a very clear answer to that question. And one other question to you, perhaps, then, just to follow up. How can we ensure that healthcare workers are trained to recognize and treat neurocysticercosis?
Yes, so this is a follow-up to what we are working on in the action plan, is that we are trying to educate not only neurologists and specialists to recognize neurocysticercosis and to try and identify the causes of epilepsy, but we are also trying to educate primary care physicians, pediatricians, and nurses and healthcare workers who are actually working in the remote areas. So this is one of the very strong points of our current action plan, and we are hoping to have it finalized by early next year so that we can start actually implementing it in different countries.
Thank you very much, Nicolene. A couple of questions in the chat. I'm coming to you, Ulrich, on whether Bayer could actually manufacture or be enticed to manufacture oxfendazole. But before that, I think from our side, we will need to also clarify whether the drugs are given with food or not with food. We'll get back to you on that. We will be circulating some of the answers to the questions following this webinar, and we will see how to best provide you with links to the presentations following this webinar. In the future, we are hoping to have a space, a one-stop shop where we can put all these tools in one place so that you can have easy access to it. And we will please just keep an eye on our Taenia website so that you see any upcoming news that we should be having. Ulrich, over to you with regard to the question about perhaps Bayer taking on the production of oxfendazole.
Thank you very much, Bernadette, and thanks, colleagues, for that question. I think this is a very, very new proposal. In the current setting, I find it difficult to imagine that Bayer would take up this production, but I think, Bernadette, we would have to look into that in some discussions after this meeting and see where the needs or the hurdles are.
Thank you very much, and sorry for putting you on the spot, but that's the way the webinars work nowadays.
No problem.
Thank you. So we do have clarification on the guidelines whether to be given with food or not. And I'd ask Marichal to please highlight what our guidelines say with regard to praziquantel.
Yes, thank you, Bernadette. So the Teniasis guidelines say that when praziquantel is given for schistosomiasis at 40 milligrams per kilo, then they should be given with food. Okay, the schistosomiasis guideline have priority in that respect, and that's specified in the Teniasis guideline. Is one of the considerations. Thank you.
So apologies for any misunderstandings on that, but I think we have a clear answer to it. Any other questions that we can from you? Marichal, if you have picked up any, please go ahead and help me.
I apologize. I'm trying to reply at the chat as I go, so I'm just very straight. So I apologize to all the people making questions. I'm doing my best. I don't know, Bernadette. I think that we've been trying to do the majority. People is asking for the links and for the presentations, but I think you addressed that. Some people is asking if the drugs can be available outside the Ministry of Health.
I think on that question we can address now. With some projects that are closely linked to the Ministry of Health, we often can get an agreement between the research group and and the Ministry of Health to deliver, and of course with Bayer, to deliver the drugs if needed in some situations. It's on a one-on, we'll take the decision as we go, and also whether we have sufficient drugs to also cater outside of the Ministries of Health.
There's a question about the meat inspection for porcine cysticercosis, and what we can say is that meat inspection is very useful, but it only detects the very heavily infected animals. And I can see some of the participants have also done research on that, but it will vary, but might be that only about 20% of the infected animals can be detected. So it's very good to do because really it will identify some animals, but it will not identify the ones that are not heavily infected.
Thank you. Anything from the regional offices that you would like to highlight in the area of Taenia solium, the progress being made, any barriers that we think we can overcome, those that are a little bit more difficult? I think one of the messages that has come out today is really trying to see where there are synergies. I see there are many groups online who have been offering to coordinate their work, for example, from the schistosomiasis with Taenia, looking at the surveillance and monitoring. How can we add on Taenia at a minimum additional expense? How can we do delivery of drugs in a more coordinated way, perhaps the awareness and community engagement in a similar way, so that we are coalescing our efforts together. There's
a question from Ebenezer about if it's the same drugs used for the treatment of both pigs and humans, and the answer is no. For pigs, is used oxfendazole, and it's used a high dose of 30 milligrams per kilo, while for humans, for neurocysticercosis, as you can use albendazole or praziquantel, or for teniasis, you use niclosamide and praziquantel mainly, or albendazole.
So another question that's about pig vaccine supply chain. Again, perhaps Marisha, you can take this one. Is there any information on the consistency of pig vaccination supply chain and the registration of the vaccine in more countries?
Okay, so the vaccine is not a commercial product. There's no commercial interest. So the manufacturer is slowly trying to register in the different countries. But because it's a very specific product used for public health programs, if the vaccine is not registered, in many cases it can be used under the dispensation from the veterinary services, because it's for a limited, it's for very concrete use, and it doesn't have a commercial benefit. So the manufacturer, IAL, is doing their best to try to register. And as more programs are setting and developing, then the supply will be, the official distributors will be set up. But at the moment, if someone is interested, they need to contact India Immunologicals Limited directly.
Thank you very much for that, Marisha. We're coming to the end of our time on this webinar, so I'd like to start to close the webinar. I think it's been a very, very informative and very active webinar, despite not being sitting with you in the same room. It's been a very well visited webinar, and we hope that this is only the start to future collaboration with you. If countries need a more in-depth sort of deep dive into the tools available, the how-to, we can do that via, please contact your regional offices and we can do that. In the future, the next thing we are planning is to have this one-stop shop where we'll have all the information available. With regards to the materials today, we will look for putting them up in a shared drive and posting them to you either through our internet or via your email connections that you put through in Dropbox, in Zoom. As a sort of closing remark, as I said before, we didn't cover two main areas very, very closely. One was around wash and sanitation, the other one around community engagement. Hopefully we'll have the second part to this webinar soon. And we will work on those areas if we have the deep dives with the countries. There will be translations available as before. We would like to encourage our other sectors and disciplines to really join in to help in really preventing and using Taenia in this big discussion around One Health that is going on following the COVID pandemic, that One Health is so important. Join us also on the endemic diseases to find ways and means in preventing and building systems that actually cater not only for the pandemic diseases, but also for the endemic diseases that actually are a burden to communities, both in their human health and in their animal health output. So join us in that, and we look towards working together and implementing these tools. From my director, thank you very much for joining us today. Should you have any questions, please either email me or my colleagues, and we will try to get back to you with the relevant information. So with that, I want to thank all of you who have participated today, the presenters and all of you as audience, but also as before, all those people who have really made us make progress over the last few years. It has taken a few years, not just weeks, to put this together. And we look forward to now scaling this up, using our tools to the benefit, finally, of the people most at risk of neurocysticercosis. Thank you very much, and look forward to the next time. Bye-bye.
Bye-bye.
Thank you.
Thank you, everybody.
Thank you.
Thank you.
Thank you. Bye.
Thank you. Bye-bye.
Thank you.